talk about your health and wellness. Dr. Tim McKnight. Good morning. How did you find your walk-in? Was it all right?
I did okay today, yeah.
Just thought that was an interesting song in the long run because if we're talking about feet, that can be a problem. And
yeah,
so,
yeah. Actually, you are right. Running and trauma to the toes, repetitive trauma to the toes, can make you susceptible to today's topic, which is ingrown toenails. And they're pretty difficult to treat. I suffered with them for a while until I just got bold and got the right treatment for it. But yeah, a lot of people have this. It's a real common problem. Those real thick, crumbly yellow nails on your toes. Sometimes you get them on your fingers, and people come in pretty frequently asking, "How do we get rid of these? And why do I have them?" And so it's pretty common. And I was like many people, just give me this simple approach. They used to have a lacquer or a nail polish that you could paint on the nails that was supposed to kill the fungus, but those have kind of fallen out of favor. They're not really that effective. When you have that, when the entire nail is thick and crumbly and ugly looking, that number one, we should have a clear diagnosis first. We usually take a clipping and we send it off to culture and prove that it's a fungus.
Okay.
But for the most part, we can tell before we do that. The treatment that gets rid of it actually is a tablet. It's an antifungal. There's a couple different antifungals, but the best one is Lamisil or terbinafine. And for the toenails, you take it for 12 weeks, and for the fingernails, it's 6 weeks. The problem with that is it can cause some liver problems, so you have to get blood work. Either you have a healthy liver before, or 6 weeks into the treatment, halfway into the treatment, you have a blood test to make sure it's not causing any liver damage. There are some people that take medications for heart rhythm problems that have to be really careful with the antifungals. So that's a caution. But for anybody else, if you're not taking a lot of medications, or particularly medications that can be hard on the liver, you'll probably have no problem with this oral antifungal.
How does a fungus get into your your system, but under your nail, especially? Yeah. It seems like the toes are way more susceptible.
Yeah, it does. Funguses live on our body. They're opportunistic, so under the right conditions, they kind of grow uncontrollably. And with the feet in particular, it often has to do with repetitive trauma. So if you're a runner or you're doing any sports where there's a lot of banging and jamming of your toe against your shoe, if the shoe isn't fitting right, that sort of predisposes you or sets you up. And then other people can be just poor circulation. Diabetics are more susceptible. So it can be a real difficult problem. And as you get elderly, what we're doing is you're seeing a podiatrist, and they're trimming them frequently to cut them back, because sometimes it gets so thick that an individual just can't get them with clippers, and they have to see a specialist. But the point I'm trying to make is that it's a very treatable condition for most people if they have no contraindications for the medications.
As far as an ingrown goes, you can get to the point where you have to have an outpatient surgery.
Yeah, ingrown toenails are also often caused by shoes that are too tight, women in high heels with the pointed shoes. It's basically what predisposes you to the ingrown toenails is having your toes kind of tightly squeezed into a shoe, and it pushes on the skin, usually on the outside part of the nail, and by the outside part of the nail, I'm talking away from the midline, because if it's your big toe, it's usually pushing on the toe next to the big toe, and that kind of pushes the skin up over the nail, and it can get inflamed, and then it can get infected. I usually tell people to soak their feet in Epsom salts. Don't wear the tight-fitting shoes, and see if that will resolve it. But sometimes they're really red, really painful, and we have to remove either the entire nail or that half of the nail. And that's a pretty simple thing to do, but as you mentioned before we got on the air, sometimes the anesthesia for that can be a little bit painful. And I've been through that as a patient, and I also do that frequently office. What I like to do is numb the toe at the base of the toe, The numbing medicine obviously burns a little bit, but we're trying to numb the nerve on the inside and the outside of the toe at the base. And if we numb that within 5-10 minutes of numbing the base of the toe, it'll work its way down to the end of the toe, and then we can remove the nail. And there should be no pain, just a little bit of pressure, but no pain. It comes off pretty easily.
And then it just takes weeks or months to grow back.
Yeah, it does. It takes a while to grow back. For those that have repetitive ingrown toenails, there is a treatment that we use to block the toenail from ever coming back. But the toenails are supposed to be there to protect you from things dropping on them. So unless you really have a problem with it, I prefer not to permanently damage the nail so it doesn't grow back.
Yeah, I do that too. Moving furniture is not a good thing for your feet.
Well, especially if you drop furniture on your feet or weights or other things. Yeah, my toenails were predisposed, I think, to those problems with, kicking a ball and playing basketball and running and just the shoes. I have white feet, and it's hard to find the shoes, the white enough shoes. So I tend to kind of stuff my feet in the tight shoe, and it predisposes me, so I have to be careful. But it's a real common problem, both the ingrown toenail and the fungal infection. But the treatments are pretty simple. See somebody that you're confident can take care of it, especially if it's a surgical procedure, because like you said, sometimes those can be a little uncomfortable if you're seeing somebody that hasn't done a lot of those.
But over the counter, is that possible with any of that medication you talked about?
Yeah, if you have if the infected or fungal infected toe is just on the end, you can try the over-the-counter antifungal creams, and you can clip your nails back. Some people will try to soak their toes in vinegar or something acidic to kill the fungus, but I'm not sure how well that works. Yeah. So if you try the over-the-counter and it doesn't work, then you probably ought to see someone who can make sure your liver is healthy and then put you on some medication, and it works like a charm. It works really good. Again, I was reluctant to do it myself because I knew the potential for liver problems, but a dermatologist reassured me, hey, this is, in most cases, this is not a problem at all. Don't be afraid of it.
And you're only taking it for a short amount of time.
You take it for the toenails, you take it for 12 weeks.
Yeah.
And for the fingers, it's 6 weeks.
Well, I guess the good news is open-toed shoes are in vogue when it's 93 degrees.
That's true. The other thing is this time of the year, people are at swimming pools, and athlete's foot is another a fungal infection that you get between the toes, the web space of the toes, and it itches and peels, and it's pretty miserable. So for listeners who are out there who are at the swimming pool, when you're in the shower, keep your flip-flops on. Don't be walking in a wet shower where the fungus tends to really like to grow. So just be careful that way.
You're not going to catch it in the pool because of the chlorine.
Right. That's right. It's in the showers where it's always wet and it's opportunistic. So somebody carries it and they leave it on that wet floor on their feet, and it's just sort of harbors on the floor. And then the next person, if you got a nick or a cut or on your bottom of your feet or a scratch, it really is a great way to infect the toe or the feet.
Yeah, that's painful. And John Madden is not always around to spray your foot for you.
Yeah, I guess not.
Well, hey, thank you. I mean, this seems to be a time of the year when I don't know, the feet just seem to be more.
Well, people are looking at their feet, right?
Yeah, that's true.
I mean, we're always looking at our feet, but in the summer when you have your sandals or flip flops on, and you're at the pool, you look down, you think, boy, those nails are ugly. What can I do to get rid of that? So the treatments are pretty simple and effective.
Well, there you go. And if you can't remember all this, remember it'll be on our podcast later.
There you go. Yeah, Thank you.
Thanks for coming in.
You're welcome.
That's Dr. Tim McKnight, This Morning Talk with the Doc.